Did you know stroke is the nation's 5th leading cause of death? Response time is critical. And today, Dr. Avni Kapadia, neurologist with Memorial Hermann, is joining us to break down the 2 major types of stroke and the warning signs to look for. Dr. Kapadia, welcome to Houston Life.
Thank you.
Nice to see you. This is something that maybe makes people uncomfortable. We don't want to have these conversations, but it is so critical to have these conversations in advance. We need to know the signs, what to look for, and also where to go in the event we are seeing some of those signs, correct?
Absolutely, absolutely. Memorial Hermann has 10 certified stroke centers, 4 comprehensive stroke centers, and 6 primary stroke centers to help take care of all of our Houston population here.
And going to the people who are the best, people like yourself, who know what to look for, that really is critical because, I mean, we're not just talking life or death, we're also talking about quality of life after an event like this.
Absolutely, absolutely. We want to help ensure that every person that comes in and gets treated for a stroke can lead the most meaningful life that they possibly can and the quality of life that they want.
Yeah, we want people to stick around for as long as possible, right?
Absolutely.
So we mentioned at the top here there are 2 major types of stroke. Explain what they are and the difference between the 2.
Absolutely. So an ischemic stroke is when there's a blood clot in the blood vessel that prevents blood and nutrients that the brain needs from getting to the brain. A hemorrhagic stroke, often people call them brain bleeds, is when there's a weak blood vessel that bursts open and then there's blood that leaks out into the brain.
Okay.
Both of them lead to the brain tissue dying off.
And are these things, I mean, are there signs that we would notice when either of these scenarios are playing out?
Absolutely. There's actually an acronym that's very helpful. It's called BFAST.
Okay.
So the B stands for balance. So you want to check if the person has a loss of coordination or a lack of balance. E stands for eyes. If there's a change in the patient's vision, such as double vision or blurred vision. And F stands for face. If you ask your loved one or the person you're with to smile and seeing if there's a facial droop or something that's abnormal with their smile. A stands for your arms, asking the person to raise up their arms and seeing if one arm drifts down faster than the other and is weaker or perhaps even numb.
Okay.
And then S stands for speech. Speech is, are they slurring their speech? Maybe they sound like they might be a little bit drunk all of a sudden.
Okay.
Or maybe some garbled speech or a word salad. And T stands for time. If you notice these signs or symptoms, it's important to call 911 and get your loved one or the person you're with to the hospital immediately.
Immediately. And as we can see on the screen right now, if any one of these signs occur, so people don't have to be showing all of these signs, even if one of these symptoms presents itself, that's the time to call 911.
Absolutely.
Let's talk about just how much of a difference that time makes, because maybe, I mean, the worst thing that someone could do is like, oh, I'm just going to go take a nap and we'll deal with this later, right? But that could mean the difference, as we said, between life and death, which is a horribly scary thought, or the quality of life impact that someone could experience.
Absolutely. So coming into the hospital as soon as possible allows us to give interventions, either medical or surgical interventions, immediately. And so that could mean walking out of the hospital in 2 days, or perhaps going to a rehab facility or a nursing facility or requiring care at home. And so as soon as you detect these things, we have more options available for patients. And given our large network of hospitals, we even take patients from hospitals in the surrounding communities that don't have these possibilities. They don't have the capabilities or the surgeons or the doctors to take care of these things.
You know, and it just underscores we are so lucky living in the Houston area that we have access to doctors like yourself and, I mean, really the best medical care in the world. Dr. Kapadia, we mentioned that I mean, it's the 5th leading cause of death in the United States. That is a huge, huge number. In addition to the symptoms and the signs we should be watching out for, are there things we can do to prevent having a stroke, or that we can talk to our loved ones about?
Absolutely. It's the same things that we caution patients about for heart disease. Healthy diet, exercise, and we're not talking about running for the marathon this weekend, but even a brisk 30-minute walk 3 times a week can be very meaningful. And we're not asking our Texans to cut out steak completely from their diets, but introducing more chicken or fish or more vegetables into their diets can be very meaningful.
Let's say, though, there's someone out there watching and they say, okay, well, I don't really exercise. Maybe I haven't been taking the best care of my heart health. Are there things that a specialist or a doctor could point to in maybe an annual physical exam? Are there concerns that you could bring to your doctor to say, hey, am I at risk of having a stroke?
Absolutely. Annual physical examinations are absolutely important. Going to your doctor, they will have set laboratory workups, certain physical examination findings that they'll look at, given your age and your other risk factors like your family history or other medical issues you have, to help you prevent having a stroke in the future.
Dr. Avni Kapadia, thank you so much for your time. Again, it's such an important conversation to have around the dinner table with your loved ones, and that acronym, Be Fast, is something we will all remember.
Thank you so much.
All right, thanks again. And Memorial Hermann, by the way, is hosting a free online webinar happening Tuesday, January 25th from 6 to 7 p.m. It's a chance to learn more about the latest treatment advances for stroke. You can RSVP by calling 713-222-CARE or visit memorialhermann.org/stroke-network-webinar.